Welcome and thank you for your patience. I am Dr. Amy Baxter, and today I will be speaking on vibration science. Nikola Tesla said semi-famously that if you want to find the secrets of the universe, think in terms of energy, frequency, and vibration. So we have known about vibration as a therapy for a long time, but this is not your grandfather's version of vibration that we're doing now. If you have questions, please put them in the chat. Someone will let me know if there's a question, and I will try to answer it ongoing. Otherwise, we will have a time for Q&A at the end. There we go. So again, this is being brought to you by Pain Care Labs. We make multiple different lines of products that primarily use mechanical stimulation or vibration as the primary therapeutic. So Buzzy was started for injections. VibraCool is a lot of what we'll talk about today for musculoskeletal. Duotherm has harmonic vibrations, and then VibraCool Pro is a new one. This is kind of nice because usually when I'm doing lectures, I have to make my disclosures and talk about the fact that I'm not going to mention products, but I am. So today I'm not only going to talk about the science, but I'll also talk about how we incorporate them and how it compares to other different ones. Now, the objectives, if you think about a TV show they used to have called Actually, so if somebody is making a comment to you about vibration, I want you to be able to say, actually, the new science on that is blah. A lot of people think back to some guys named Melzack and Wall in 1965 who found that a sensation of touch or pressure could block pain, and this was called gate control. I was talking to someone yesterday who said, oh, I thought that had all been disproven, and I was able to say, actually. So today we're going to go through a word from our sponsors, because I can. Vibration history, vibration science, some new neuroscience, clinical indications for different kinds of vibration, and specifically VibraCool, then the comparison between options and future uses. The amount of interest and research on vibration stimulation in the past 8 years has really exploded. So there are a lot of exciting new uses, and I'll talk about why they make sense. So the devices that we make are for four specific packaging, but the thing that makes the most difference is the frequency and the amplitude of the vibration. So one thing that frequently people will say is, are these products TENS units? Are they pacemaker? Are they electrical? They are not. We're using the gate control that people can conflate with TENS units. TENS is transcutaneous electrical nerve stimulation. We'll talk about that, but our devices have a palm-sized vibration unit and can have heat or cold, and then have items within the packaging that will allow for placement on different body parts more optimally. Some of the benefits we'll talk about for vibration are that you can have drug-free pain relief that is controlled by the patient, and high frequency vibration actually increases blood flow, improves range of motion, speeds bone and muscle repair, and we are getting a new indication for myofascial pain after surgery. So we will talk about all of those. I'll also talk about how this would be used in 3 different use cases. The patient who needs a knee replacement but has trouble walking. The patient who has an overuse injury. This is actually me and a friend of mine, and he was our first tendonitis cure. And then someone who has low back pain and cannot take opioids and needs an alternative. So without further ado, let's go way, way back to the 1800s. So perhaps the inventor of the modern day gym, Gustav Zander, built a vibrating Swedish exercise machine. This was intended to replicate the sensation of being on a horse. You may have seen later ones in the 50s with the idea of losing stomach weight, but this was really more to try to replicate horse riding. horse riding became really important for Maurice Charcot. So Maurice Charcot is the father of modern day neurology. He is pictured here. And he just realized that his Parkinson's patients, when they came to him, their clinical exam was better, they rested better, and they felt better when they had come on a carriage ride immediately before he saw them. And the concept was that he hypothesized the bumpity, 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 bumpity of the cobblestones and the carriage combined to create a therapeutic effect on the Parkinson's slowing of the triggering of the movements. So he created the first whole body vibration machine, which was a chair on a vibrating plate, which you can kind of see on the corner there. So whole body vibration has pluses, has some studies, some meta-analyses find that it doesn't help for different things. Some studies find that it does. The place for whole body vibration certainly is not for Parkinson's at this point. That's not where we think it works. But whole body vibration at very low frequencies does make the joints and the joints less painful and muscles stronger. So there is a place for this in workouts. We'll talk about this later. Now, after Charcot, he had a student named Gilles de Tourette of the famous syndrome, dang it. And so Tourette was trying to use his mentor's technology of vibration to help other neurologic maladies, like migraines. This, I think, is one of the images that has caused vibration science to be very erratic, because this did not work for migraines. And when people have a modality like MRI or lasers or warm packs, they tend to lump all of the research with those modalities in one place. And as we've learned from biology science, there are certainly some treatments, poultices or whatever, that work in one environment but not in another. In chemistry and chemical science, we know that there are doses of medications that will not work, but then a higher dose will, or vice versa. Likewise, in physics science, there are so many more permutations of dose, orientation, duration, amplitude, that we have tended to lump all of the science and the results into one binary, yeah, it worked or no, it didn't. That's not how physics medicine works. So after the vibrating hat, because vibration was felt to be just, oh no, that actually doesn't work, the next time we see an example of vibration science in medicine is in the 1950s, when a vibrating bed was used for patients with long bone fractures. It did decrease pain, and it did improve the speed of bone healing. I'm not sure why the next time we see vibration again in science isn't until the 80s, when another Swedish investigator started looking at vibration for low back pain. Maybe it's hard to get your scientific advisory committee to get behind your research into vibrating beds. I don't know. So in thinking about understanding why vibration would make sense for musculoskeletal changes and improvement, you have to understand the nature of the tissues themselves. So if you think about how tissues are connected between bones and tendons, in some ways, this is kind of like a suspension bridge. Now, one of the things about the way the body works is that it's called Wolff's Law, but the tension or stretching or stress that is not damaging causes growth. We all know this. If you think about doing push-ups, you know, the push-up is making your pecs work and stretch, and they get bigger, they grow. We don't actually put a humerus fracture, an upper arm fracture, we don't put them in casts, because there are so many muscles around the bones of the humerus that it heals faster with even just a little bit of motion and movement rather than immobilizing it. So these tensions make things grow better and grow faster. Other thing about the body and vibration is if you think about any group of tissues, they're going to have a resonant frequency. So if you think about the Golden Gate Bridge and the metal that's stretched along, if you hit that rope, the metal struts, it will vibrate at a certain sound. It will vibrate at a certain frequency. And it doesn't matter where you hit it along the way, it's going to have that because the intrinsic characteristic of a tissue is it has an intrinsic frequency. So activities like walking, for example, have a frequency. And the most intense receptors for vibration are in cartilage and tendons, and those are in a receptor called the Pacinian corpuscle. So thinking about amplitudes and frequencies are important because materials have resonant frequencies. And so you want to have the optimal amplitude and frequency to trigger a tissue to behave at its most intense. One other thing, and I'm not going to get any more in the weeds than this, but one other thing about vibration is that it acts like any kind of oscillating energy. So we use a cylindrical flywheel, and so that gives a periodicity that gives the vibration. But you can also do vibration with sound. A lot of the studies in Italy and in Europe are using diaphragms, and so they are giving the amplitude, which is the strength, and the frequency, which is how often, they're giving that with a diaphragm. When we talk about harmonics, what that is the energy that's in the wave. If you have two different motors, that energy, when it interacts, is going to have a higher peak. And so that higher peak is going to be what we call harmonics, but it's going to increase that amplitude. So if you look at this orangey one right there, that one will be higher when you have two different motors that are providing something at the same side. So it's not just the strength, the amplitude, and it's not just how frequent. What we've also learned is that the duration is going to impact what the effect is of vibration, and actually the orientation. So the direction that the strength is put on the tissues, all of these things play into the clinical effects of vibration. Now, one of the reasons vibration science languished for a long time is that almost every paper published on vibration between the mid-'80s and the early 2000s was on damage, because vibration can damage nerves. This is a chart that is used in OSHA and workplaces that shows how many minutes of a certain amplitude or strength you can be exposed to before you have nerve damage. The nerve damage that comes is called finger-hand syndrome. It is much worse in the small nerves in the hands, and the nerves in the fingertips get cold and they don't feel sensations. The reason this matters so much is because if you are applying vibration therapy with a massage cannon, and your hands are shaking, then you are getting vibratory damage. If you look and see, if you're doing it to yourself, vibration for 30 minutes here, this at an amplitude of 7, that's not as big a deal. But if you're the clinician and you're doing that for 3 hours, all of a sudden you've got a huge accumulation of risk. So when you are using vibration, the things that are more concerning are higher frequencies, but much more than that is higher amplitudes. One of the problems with the devices that are on the market now, particularly handheld devices that are applied to someone, is that they don't tell the amplitude in the scientific nomenclature of meters per second squared, which is telling how much force. Instead, all they do is just show this amplitude as a distance. And so based on the power of that distance, it's going to vary hugely. So this is an area that in the field we need to fix. These are gloves actually that were used to protect someone from the dangers of hand vibration. And these are used for for people doing jackhammers or tool work with machining. So just know that there are risks. And so you really have to be cognizant of where you are on the amplitude, time, and frequency. All right. So now we're going to get to the clinical stuff. If you understand a little bit more about where we've come from with vibration, now let's go forward and talk about what we're doing and why. We started with specific interest in decreasing pain. And so the Melzack and Wall in 1965 came up with this theory that the pain nerves, these little A delta fibers, they're called, they go to the spine, they go to the brain, and before they get a chance to get transferred to the brain, there are other sensation nerves that can interact with them. One is a C fiber, or a cold fiber. Now it's slow, but it accumulates and also goes to the brain. If you're thinking about A delta fibers, these are the ones that are the sharp pain that you can stop with lidocaine. So these little fibers have sodium channels, and if you put lidocaine in, it'll block it, and so the pain doesn't transmit. Another way to block it is in the spine, and that is using A beta fibers for other sensations. Now, the C fibers are specifically, they will go slowly up to the brain, and then the brain will say, I realize this is annoying, but it's not dangerous, and then will inhibit any pain anywhere on your body. So combining this cold with other A delta pain blocking makes a lot of sense. So the kind of blocking we're doing is using A beta fibers. Now, these are light touch, shaking your hand motion, stretching, or pressure. All of these have examples that people use for pain. You have any of the cooling, like the menthol or things that you put on that tingle your skin, those are activating Mesner corpuscles, like electrical stimulation, like TENS units, electrical stimulation on top that's tingling your skin. The Ruffini organs are stretching. So this is yoga, Tai Chi. So these are what are being used to decrease pain with those A beta nerves. The Merkel disc is pressure, so massage or acupressure. That's what's being used, and that's the same mechanism, but the strongest of these is the Pacinian. So we started in 2009 using vibration and ice together to block needle pain. What we discovered was, and not just us, but other investigators, so it turns out that each of these different receptors has different frequencies that trigger them. And the one that is 90% of pain relief is the Pacinian corpuscle, and it is triggered at a very high frequency, and it also doesn't habituate. So one of the questions about that we often get is, if you leave it on too long, do you need to change it? Is the body going to get used to it? And while all of the other nerves do get used they'll quit firing over time. You'll sit down and you feel the pressure, but then you don't feel it after you've been sitting for a little while. But the Pacinian doesn't stop. And the reason for that is if you're trying to run away from something, or you feel a burn and then you withdraw your hand, you need to know where your body is the whole time. And that need to not lose your position sense doesn't go away. All right, so one of the first things people often ask about the whole, is it TENS? This is why there's a difference between mechanical stimulation and electrical stimulation. So the first thing is that mechanical stimulation is very easy to refine what the frequency is. And so 200 hertz is right in that little sweet spot of where the Pacinian fires. But the other thing is that these nerves are deeper. And so the Pacinians, like I mentioned when you saw the arm picture, those position sense nerves are strongly related to the joints and to the places where the muscles attach. So this is usually where there's injury and pain. So it's great that that's the place where this pain relief can happen. Now, TENS units are using electrical stimulation between two patches. And that means that the electrical stimulation is very superficial. So if you look at the level of how far that amplitude is descending, the impulse is not really getting down to where the joints are. So this is why electrical stimulation will give you the same effect of a light tingly pain relief, but it's not going to give something that is a deeper, more intense pain relief. The other thing about the vibration is that vibration is inherently comfortable for about 97% of people because it's stopping pain. Electricity is felt to be unnatural and doesn't get to the strength, the amplitude that it needs to be about 50% of the time. So how would you use vibration in different clinical settings? So one thing that vibration does is it separates the muscle fibers, but without trauma. When you have an overuse injury, like IT bands or an ankle that's been twisted and is healing and it's tight, what happens is that the cells will release inflammatory markers called cytokines, and it'll release things, and it also releases lactic acid, which is something that will glue those muscle fibers together. The initial goal after an injury is to bring in inflammatory things to speed the healing, to make the area as tight as possible so it doesn't move and re-injure. So there are a couple of things that vibration does. First thing is ice with vibration will decrease the inflammation. The vibration will increase blood flow. At about 150 hertz or higher, the sympathetic system is stimulated, and that opens up the blood vessels and brings more in. So you can clear out all of those inflammatory markers that are forming, and you can decrease the formation with ice. So putting VibraCool for 20 minutes with ice on an area that is tight or hurting after you've moved it is a great idea. The other thing that works well is to use the vibration alone to loosen those muscle fibers before a workout. So that's where stiffness, the prior activity, that's going to be something with VibraCool alone or VibraCool Pro. And then when you have an injury itself, the vibration and ice. Now for pain, it can be put directly on the site if the dressings have been taken down, or if they haven't been, then you want to put vibration between the brain and the pain. The reason is because what you're doing with that vibration is you're stimulating the nerve tracts that are going to go to the spine to the brain. So if you can put them in between where the pain is coming, gives them a little head start. There are certainly people that will put VibraCool below, and that's fine. But for most extremity surgeries, you want to put it above where the dressings are. And again, 20 minutes for pain relief with the ice, and then the vibration can be left as long as you want to, so long because it's a very low amplitude. Plantar fasciitis, that's one where it's better to just go with ice and vibration immediately. Same thing with tendonitis. So tendonitis, if you have it and you're hurting before you move, first thing in the morning, go ahead with 20 minutes, ice and vibration where you hurt. Can you tell that I actually have tendonitis? I've got my VibraCool here, so I can put it on my elbow in the morning. One of the things that's coming in the future with vibration is that there's a number of studies that are demonstrating bone growth. It makes sense because of Wolff's Law. It makes sense because of the way the cells are designed. But new studies that will be coming down the pike are looking at frequencies for stimulating bone growth. For this reason, both for pain and for repair, putting vibration on a rigid brace, something that we'll be seeing in the future. Pressing the vibration in is important because if you don't have a force that is causing the vibration to penetrate, then it'll just push against the skin and come off. Looking at how effective vibration is against electrical stimulation, what you're seeing in this set of clinical trials, the dotted lines are vibration because it's intermittent. The tens is a constant. And so these are a crossover of people who came in to a physical therapy office and were randomly assigned to either get vibration or to get electrical stimulation. So M-stim or E-stim. And then they came in the other day and they got the other one. So what you're seeing here is that the pain that they came in with on various days. So let's look at this red one. So an overuse injury, like an elbow. Initial pain for these guys was the same on both days, an 8 out of 10. After 20 minutes of using either E-stim or M-stim, the pain for TENS unit didn't even clinically reduce, but for VibraCool, it was about 2.5 on a 10-point scale. So on average, the best places to think about using vibration from VibraCool are overuse and then spine. So spine and joints are really good because there's so many Pacinian corpuscles there. Looking at this, the position sense really matters. Now, another reason to use vibration science, and particularly VibraCool, is that when you have a pain scale from no pain at all to extreme pain, the things that really make a difference after physiologic interventions like an ice pack, a heat pack, vibration, are that the patient has control and that we decrease fear. So if you think about the fact that fear and control are the volume knobs for pain, then that gives a little indication of why having a device that a patient can use at home and that they control is very helpful for pain. One of the things that patients like and is immediately active is thermal. So this was why we decided to add either hot or cold to the VibraCool, because both tend to work equally well. Patients know what they want. Now, if it is an acute injury, those with a lot of inflammation, those are typically going to feel better with cold. If it is a chronic injury, either ice or cold can help. So both in the VibraCool, the heat packs and the cold packs both either become solid and crystalline or are frozen solid because they need to transmit the vibration through. Vibration transmits beautifully through solids, not as well through gel. So in order to keep the therapeutic amplitude and frequency constant, but still get the benefit of thermal, you need to have a solid thermal source. Now, when we talk about frequency, there's a really interesting movement in what we're finding in the discoveries. So one thing is that if you're looking at whole body vibration, like on a plate, those tend to be 30 to 50 hertz, and they are decent amplitude, about 2 grams. So instead of a milligram, these are really shaking hard. They improve balance and they decrease pain over time. They also help strength because what they're doing is they are making your muscles work a little bit harder. So these do have good data for improving workout strength, and particularly for decreasing pain for older people, because the vibration causes some stretching and regrowth of the ligaments and tendons around the main joints. Interesting things that we're finding about how pain works in the brain is that movement is connected to decreased pain. There's connections that show that the motor area of the brain actually has connections to inhibit pain in the sensory area. The other thing that's interesting is that the way that cells in the brain regrow and change over time is fueled by it's called there are 2 different growth hormones in the brain that cause the brain to remodel, but both of them are responsible for increased pain with chronic pain, and both of them go down with movement. So movement and exercise, and kind of fake movement and exercise with a vibrating plate, all of those things help the brain decrease pain and also can help strength and balance. Now, those effects in these studies are actually very small. So they're significant over time, but they're not very big. When you start looking at bigger impacts, you start looking at higher frequencies that cause bigger impacts. So one thing is that delayed onset muscle soreness. So before you work out, the reason you stretch is so those muscles don't catch on each other and rip and cause injury. Using vibration alone for 5 minutes decreased delayed onset muscle soreness the next day, as well as 30 minutes of stretching. The frequencies for delayed onset muscle soreness that seem to be working the best are actually lower than our devices. 200 hertz will still work, but the optimal ones right now that we're seeing are in more the 100 hertz range. Stroke recovery is very interesting. So what people are doing is, and there's actually 2 meta-analyses on neuro rehab, and that is putting on a vibration unit. No one has studied it yet with heat or cold, but putting a vibration unit on the area of stroke. And what this does is causing a much faster feedback back and forth from the area of sensation in the limb to a new connection in the brain. So rewiring the brain after stroke works much faster with vibration. And that research is still kind of all over the board in terms of frequencies. It's been effective between 90 and 300. Slower frequencies are not working for stroke recovery. We've talked about how 150 hertz and up improves blood flow. It also improves growth hormone and it decreases the shrinking of tissues. It increases muscle recovery and growth. And finally, the 180 hertz plus in pain relief is where we're seeing the application of VibraCool really be appropriate. Is so for pain relief, but also for musculoskeletal. Ideally, this will be something that will be covered for musculoskeletal after surgery. So it's an option to give someone control and to decrease their fear after surgery when they still have pain. Now, let's talk about the differences in different kind of instruments and when to use them, and then we'll talk about the new science, Parkinson's, stuff like that. So when you have really dense muscles that you're an athlete and you've been training and you're about to go and compete, this is a place for the massage guns. Now, make sure your hands are protected when using it, but this is where you're going to use something to physically separate those muscles. The other thing it does is probably give a little extra strength, because when a muscle's been used, there's a connection between actin and myosin, and they're usually, when they're ready to trigger, they're this, and after you've used the muscle strength, it goes back like this. And then the energy in the muscle has to rearm itself before it can go. There is no science I'm aware of for this, but it makes sense that people do have, they have found that after vibration, people have stronger jumps. And so it probably is that these muscle guns are separating, rearming some of these so that then you get a little extra power. When you have pain, VibraCool strains pressured muscles. The one thing that's important is if it is a fresh injury, you definitely want to use compression, because that increased blood flow can cause swelling if you don't also add compression. All right, so in the way that I would use it for these cases is if someone has to lose a lot of weight or if they need a knee replacement, using the VibraCool after or during a workout with very low impact, something that will decrease the pain enough so that they can get moving and lose some calories. And also, it probably has some impact on the chronic pain in the brain. For an overuse injury, you're going to want to use it for 20 minutes twice a day. And if it's overuse elbow or overuse plantar, where you're going to use it all the time, first thing in the morning before you start using it is great. For IT band or hip pain, before you go to bed will improve sleep and make it easier to get restorative sleep during the evening, which decreases pain the next day. And for low back pain, we have a harmonic instrument that has multiple motors so that patients can control where they put the intensity of the amplitude and use either heat or cold. So these are just some of the between TENS and electromagnetic and VibraCool, and I'm not going to go through it now, but this is something that we'll send around with the slides. So now let's talk about what's up and coming in vibration. One of the things that was early noted in the science of position sense was that there are 4 different nerves that all contribute to your foot feeling where you are in space. And the pressure sensations were able to be triggered by vibration and made the sensitivity higher. So what's happening is when you're standing, some of your balance comes from input from your feet, some of it comes from your eyes, and some of it comes from the inner ear. So there's 3 different systems that work for balance. If you have decreased balance and it's worse with eyes closed, then what that means is that you're missing some of the input from your feet. To increase the input from the feet, you need to make those nerves trigger faster. And one way to do that is vibrating insoles. And so having vibration in shoes or vibration in pads, constantly going off just a little bit, it makes the feet more sensitive, and that improves the balance. So these are already FDA cleared on the market. You can look at vibrating insoles and find them. But that concept is something that caused researchers in Stanford and other places to look at whether or not using small amounts of vibration could recalibrate the sensitivity for movement. So Parkinson's disease is a problem in the dopamine tracts where it needs to have a higher stimulus to move. And so there's a catch, a delay before moving. The study is being done with 250 hertz in Stanford, and it's being put on the fingers, and different kinds of arrangements of vibration are being used. Whether this is going to improve Parkinson's, the initial trial, it looked like it was. There's certainly a long history of vibration and Parkinson's. The question is, we have no idea how long, how much a day. We don't know if it needs to be in the fingertips. We don't know if it needs to be someplace else. The thing about the fingertips is that they occupy a lot more area of the brain. So if we're going to be retraining the brain, using the place tactily that has a lot more area makes sense. However, because of the issues with long-term use and vibration and hand signals, it may be in a few years that we end up using more arm or leg vibration rather than fingers. So this is very new. It is not yet ready for prime time. Many people have asked me what to do with early Parkinson's, and I was just at the NIH last week, and I talked to several neurologists and neurosurgeons. Seems like the best research right now is to directly stimulate the brain so that the slowness of the receiving of the signal is sped up. So it's called deep brain stimulation. It does require a surgery, but early application of DBS and Parkinson's right now is one of the things I would do in addition to using 200 to 250 hertz, probably on wrists and ankles. I'm still worried about the fingers. All right, I do have a question. I'm going to grab that one. And if anybody else has a question, please feel free to put it in. So the question is, comparative studies with TENS for immediate pain relief is impressive. How long does the vibratory pain relief last? This is such a great question, Dawn. So the pain relief that we found in our phase 1 low back pain device trial was about 4 hours. Now, that's using 3 motors. What is interesting is that it depends a lot on the injury, but if it's a non-acute injury, so overuse injuries, the back pain injuries, it tends to be between 2 and 4 hours. Now, if it is something that is extremely painful, like a meniscal tear and you've been standing on it, then the pain relief duration is going to be less. One of the amazing and interesting things I'm so excited to study is that the Lundgren, the Swedish guy who did the low back pain thing, he found that the pain relief at 15 minutes of vibration lasted for a few hours, but when the vibration was left on for 30 minutes or more, people would get days of pain relief. Now, we're certainly not seeing days of, well, in some cases we are actually. Some of our low back pain device people say they need it about once every 3 days. But I think it's, it kind of goes back to that whole 3-dimensional grid where you've got a lot of variables that you're testing. Eventually, we will know this amplitude, this frequency, this duration tends to give this degree of pain relief. But there's so many variables: the thickness of the skin, the muscle, the location on the body, how many Pacini and corpuscles there are. I think we're at a really early phase of science with being able to control things like amplitude, frequency, and orientation and torque. So it's kind of a stay tuned. But what I will usually tell people is the same thing we tell them with our Buzzy device, that if you're talking about itching, it's going to be 100% relieved. That's still on the same pain nerve. It's just very light stimulus. If you're talking about amputation, maybe it'll help a little. So the spectrum of pain is going to really impact how much duration of pain relief you get. Thank you very much. Does anybody have any other questions? This is an awful lot of science to digest in one fell swoop. I would like to say that we have videos that talk about using VibraCool for different circumstances. So whether it's prehab before knee surgery, whether it is using it in a skilled nursing facility. One of the great things about VibraCool in a skilled nursing facility is that it's completely safe, class 1 FDA cleared for duration. So you're not going to mess anything up. But if you have a patient who may have memory issues, and they're in pain, you can put it on to help them with their pain. And if they forget that they've taken medicine, they won't forget that they've got a vibrating thing on their hand, arm, wherever they're hurting. So that's a really nice help for environments where you may not have a lot of nursing staff, but you've got patients who have real needs. So one question was, in an elbow fracture where the intervention is placed screws and a metallic support plate, can VibraCool help the healing and growth of the bone in the fracture area? Don't know yet. It's logical, but right now the biggest bone healing studies have looked at an elbow or a distal wrist fractures, and it was trending toward, but not significant. As I recall, it's a Japanese IMAI. It was the person who did that. Helped a lot for pain, but the healing time equivocal. For rat bones healing, the 15 minutes of vibration was equivalent to 4 hours of electrical stimulation. So I think we're going to see a lot more in this area. But the one place I can tell you personally it's great for is rib fractures. So heat, vibration, and rib fractures with the flex unit are amazing at relieving pain. The therapeutic and relief significance of ice causing descending inhibition. So the way the brain processes pain is to assess whether there's danger, and if not, decrease the sensation of pain anywhere. So there's 3 different things that ice does when you put it on. First of all, 4 different things. First of all, it stops creation of additional inflammatory pain irritants. Second thing it does is it slows nerve conduction. So when you put ice on, it's going to slow the conduction of the nerve. This is part of why we don't want to leave ice on longer than 20 minutes, because we don't want that conduction to be slowed. But all of that research done on any risks of ice, an hour at 16.6 degrees Celsius is safe. But all of that was done without having vibration. And so if you have high frequency vibration that increases blood flow, then that risk is probably eliminated. So we've got decreased pain from the brain down. We have slow nerve conduction. We have decreased production of the pain inflammatory markers. And then we also have, there's a 4th one. There's lots of good things with ice. Anti-inflammatory, conduction, central. All right, 3. I think there's another, but that 3 is what I remember right now. Oh yeah, so evidence of use for vibration on myofascial trigger points. Yeah, actually, that is one of the very specific things that we are indicated for. And yeah, so myofascial trigger points are little connections where nerve bundles get trapped by muscles that are tight or spasmed. And so if you can open them up either with a dry needling and get in there and make them release, then that increases blood flow to them, and so they feel better. So the vibration, we have a new VibraCool Pro, and it is specifically, we're about maybe next week to get our FDA indication. And what we did was we created it so that it has a, sorry, my props. But we created it so that it has an edge that's perfect for digging into myofascial trigger points. So I happen to have a myofascial trigger point right here because I injured my shoulder. And so what I'm going to do is turn it on and then use it right at that spot. So I can use the pressure for the myofascial trigger point, but then the vibration is going to get in and help to separate it. Now, it is FDA cleared for it, but nobody has used this yet. So if you would like to do the study, Dawn, I will hook you up. But it is FDA cleared for myofascial trigger points, and I didn't think our previous device had the right intensity. So this one has a pressure that's perfect to be jammed into a muscle. All right, I think that in the absence of anyone else with questions, we will be available on email at paincarelabs.com. You can support at or info at paincarelabs.com. You can certainly look at our YouTube channel, which has a wide breadth of how to use videos. The places in your daily practice that I would put VibraCool in are anytime you're using a TENS modality, anytime you have someone that has too much pain to start doing therapy, anytime you have someone with, we're actually looking now at CRPS, where the kids who are using it are able to walk hours, go hiking with people. I don't understand the mechanism, but putting it proximal and having a vibration stimulus to counteract the chronic stimulus is something exciting. And certainly anyone who needs to not be taking opioids, this should be one of multiple ways they can control pain after surgery to avoid taking opioids. Thank you all for joining us, and let us know other topics you would like to see. We're going to have webinars every month. So thank you so much.